So my name is Mandy Tuckey and I'm a therapeutic radiographer. And this morning I'd like to introduce my panel members to you who are going to be joining us in our conversations. So first of all, I'd like to say hello to Gaby. Gaby, please, would you like to say hello?
Hi everyone, fantastic to be with you this morning. My name is Gaby Ford and I'm a physiotherapist. At the moment, I'm currently working with Health Education England as an AHP clinical fellow working on the National AHP Support Workforce Programme. Thank you.
That's lovely. Thanks ever so much, Gaby. And I'm just going to now move on to Sally. Good morning, Sally.
Morning, everyone. Morning, Mandy. Thank you for having me here. I'm really excited to sort of be here. So thank you for the invite. My name's Sally, and I'm currently a third year student therapeutic radiographer at City University of London. Currently training at several hospitals around London. Keeps me on my toes, and almost done with my training now. And hopefully in about 9 months or so, I'll be out there in the real world as a qualified practitioner. Thank you.
That's lovely. Thank you, Sally. And over to Alisha. Hi, Alisha.
Hi everyone, excited to be here today. So my name is Alisha. I'm a newly qualified orthoptist from the Uni of Sheffield and I'm currently working in Durham.
That's lovely. Thanks, Alisha. And Arron. Hi, Arron.
Morning, everyone. Again, also nice to be here. My name is Arron Miller. I'm a fitness instructor for an acute mental health trust, CNWO, and I'm also an AHP lead support worker as well. So working on the clinical workforce program as well. Happy to be here today.
That's brilliant. Lovely. Thank you, Arron. And welcome to our panel this morning. So we're just going to take the next sort of half an hour or so to really kind of give you some ideas about careers promotion and advice regarding sort of support workers and registered roles as AHPs, and perhaps something that you might want to consider as a career, and also perhaps giving you some more in-depth understanding about some of the opportunities and some of the roles that you can actually undertake in order to become a registered or a non-registered allied health professional, part of our workforce. So we're really going to hopefully give you a really nice insight into some of the things that have really inspired our panel today to want to kind of work within AHP. So I'm going to start off with our very first question. And I'm going to ask Gaby, actually, if she could tell us what really sparked her interest in wanting to become a physio.
Thanks, Mandy. So my interest probably first started through my mum. So my mum was a physio support worker working for a mental health trust. And so as I was growing up, she talked about her work, and so the idea of a career within health and a career within AHP world was always there and always present. So I guess that sparked my interest. And then also my careers advisors at school. I can't even remember what it was called, but I filled in one of those massive questionnaires that asked you all sorts of stuff, and out popped physio or teaching. Actually, those were the two top professions that popped out of that. And then I organised some work experience both for teaching and for physiotherapy, and went for physiotherapy. Seemed to enjoy that a bit more in terms of work experience, and seemed to fit a bit better with me as a person and what my talents were, what my interests were. So it's probably family and also through school and careers advisors, and also work experience, I guess, as well, that decided between the two for me.
So it sounds, thanks, Mandy. Really, really good opportunity to kind of experience lots of different things that might have helped you with your career choices. Sally, how about you? What sparked your interest in wanting to become a therapeutic radiographer?
So it's actually quite similar to Gaby. So it was my dad. But growing up, when I was having parents who've moved over from another country, didn't speak much English. I was always the child that went to hospitals, did all the translating. So I've always really enjoyed, you know, going to hospital with my mum, because it was always a nice day out. She'd get me, you know, ice cream and stuff as a treat. So yeah, I always really enjoyed going to hospital with my mum, doing the translating, and seeing how doctors and nurses and all sorts of professions would communicate with my mum and I. It was, I think that initially sparked my interest in wanting to go into healthcare. And yeah.
That's great. Thanks, Sally. What was it about therapeutic radiography that really sparked your interest, would you say?
Yes, so it was a cancer diagnosis within the family, and again, I dropped everything and sort of became that 100% carer for that family member. And speaking to the therapeutic radiographers that was treating my family members, I was really curious, and I asked them all sorts of questions. And it was actually the therapeutic radiographers that talked me into, that introduced me to therapeutic radiography as a course and as a profession. And so the fact that, you know, they answered all of my crazy questions, that prompted me to go home and research therapeutic radiography. And 4 years later, here I am.
Amazing. So that was like a chance encounter within the actual working environment. Fabulous.
Yeah, and it was really quite nice, actually. My first clinical placement, I went back to the same hospital that my family member was treated, and it had been years, and they still remembered me, and they were really happy that, you know, I came back, took their advice, and started the course. So yeah, it was great that my first clinical placement was there.
Fabulous. Excellent. Alisha, I'm going to come on to you. Now, you've got a really interesting career, and I'm guessing that not many people might have heard of your professional background as an orthoptist. So it'd be really interesting to find out what kind of sparked your interest into that career and what it involves a little bit.
Yeah, definitely. So mine's a little bit different to Gaby and Sally. So mine stemmed actually from my own personal experience. As a kid, I saw an orthoptist myself. I was seen in the orthoptic department since I was about 2 years old, up until they discharged me about 7, 8. So I had a lot of experience there. So I always knew I wanted to go into a healthcare career. But apart from knowing about medicine, dentistry, nursing, the more commonly represented healthcare professions, I didn't really know what else to go into. So I started looking into dentistry, and then I actually got an email from the University of Sheffield with loads of information about different healthcare courses. And right at the bottom of the list was orthoptics, just tucked in there. And as soon as I started having a look at the course, I knew exactly what it was, because it just brought back all the memories from when I was a kid and seeing the orthoptist myself. I was like, it just seemed like it was meant to be, really. So I started researching into the course a little bit. I found some resources online from the British and Irish Orthoptic Society, and that just really consolidated everything for me. So I sent in my application, and that was mainly it.
Yeah. So can you tell me just a little bit about what an orthoptist does?
Yeah, so orthoptists specialise in ocular motility and eye movements. So what we typically see on a day-to-day, we have a lot of children. So we'll see kids mainly for things like squints and lazy eyes. That's personally what I was seeing for as a kid. But there's also a lot more other conditions that we can see kids for. So there's different neurological conditions and genetic disorders that can lead to different eye abnormalities, and we help manage and treat those alongside a team of ophthalmologists, which are the doctors that specialise in eyes, and optometrists, which are known more commonly as an optician. So we work as a big multidisciplinary team to provide care for them. We do also see a lot of elderly patients, mainly those that suffer with double vision. And what we try and do is help relieve them symptoms for them.
Wow, so it sounds like a really varied career, and the fact that you work with so many other different healthcare professionals is really great. That's fantastic.
Yeah, definitely.
Yeah, thank you. Arron, tell me a little bit about what sparked your interest. How did you manage to find your way into becoming an OT mental health support worker?
So my journey started off quite a while ago, actually. So initially I was really involved in a lot of community development projects, mainly around social action, around sports, and mainly working with vulnerable groups and young people. So I had quite an extensive career doing that, working with various charities and corporate sponsors. And I decided to go to Lewisham College to kind of study youth and community development, but they didn't have any relevant courses. So I was advised to go and study health and social care diploma, a BTEC. Didn't really know what it was about, but having started the course, it gave me a bit of a background into sort of clinical roles, the medical profession, and sort of health and social care on a sort of more broader perspective. Once I'd finished that course, I then went back to community development. Again, had quite a bit of an extensive career in that, and then went to university to study social science. I always had a clear focus for community development. When I was on my course at Goldsmith University doing social science, I kind of wanted to use my experience in exercise and sports to kind of do a placement where I could work with people specifically in mental health. I think around that time, 2010, there was still quite a lot of stigma around mental health, and the approaches from working with regards to sort of holistic ways of working with people, and just as an intervention in itself, just wasn't really evident at the time. And I sort of saw this close link with sort of community action projects and around mental health and a lack of it, and also a lack of exercise provision. So I decided for my placement to reach out to some NHS organizations. There weren't any sort of entry pass at that time in terms of support worker roles. It was kind of very few and far between, and it almost seemed as though you had to have a clinical qualification to enter into the field. So I was a bit disheartened at that time because I wasn't able to secure a placement in mental health at the time. So kind of went back to the drawing board, continued working in leisure and various sort of fitness capacities. And suddenly enough, as a change of career, I found a job on NHS Jobs, which specifically was regarding an exercise therapist. So I completely sort of embodied what I was looking for at the time, just through looking. And this job sort of had come up, a band 4 position, and I applied. And thankfully I got the job, and I've been in the role now for about 5 years.
That's been brilliant. Thank you, everybody. And I think that's what's been really interesting, is seeing that actually you've all kind of come into your professions from lots of different backgrounds and lots of different routes, and had lots of different interests that have kind of sparked your enthusiasm for thinking about, oh, actually, do you know what, this is something I'd perhaps like to explore. And so I guess my next question is really thinking about what sort of aspects do you think of your sort of personality, or what sort of interests have kind of really helped you in kind of your chosen career pathway? Gaby, I'm wondering if you can kind of give us some insight into what sort of things have really kind of helped you.
Yeah, of course, Mandy. And it's fantastic to hear about the other three as well. And like Arron, actually, sport I was always into, and I was all right at science. So I wonder if those two things led me towards physio, certainly led perhaps people I'd chat, older adults who I might have consulted to about careers, and also school careers advisors, helping me decide which way to go. So definitely exercise, sport I always really enjoyed, and science I wasn't too bad at, although I have to say I then went on to do biology A level, which I found the hardest thing, and found it really difficult. So if there are people watching this and are finding that hard, that doesn't mean that a career within physio or any AHP is not for you. It absolutely still can be. And I've had a very rewarding career within physiotherapy. I suppose also I'm a people person, so and I knew that I enjoyed being around people. I enjoy I am an extrovert. I enjoy and get energy from people, and so I knew I wanted a profession where I would be with lots of people, and also get a kick from helping people, and trying to make life and things better for people. So again, that was steering me down a health profession, and And I think also maybe another key element of my personality that I enjoy is problem solving. So thinking, how can we make things better? How can I get around this issue? What else do I need to look to? Can I look outside the box a bit more? So really having that problem solving approach to things, which lends itself to any health professional career, but certainly within physio, that definitely ticked that box. So I think, yeah, those are probably the key things in terms of my personality. So it was working with people, it was wanting to make a difference in people's lives and getting a real buzz from that, and those problem solving skills were probably the key things for me. Thanks,
Lovely.
Mandy.
Thank you. Sally, how about you? What sort of interests and kind of what sort of personality kind of traits do you think have really kind of helped you in your kind of career?
Ooh, absolutely. Unlike Gaby and Arron, I'm not very sporty, but thankfully I don't think that's a particular requirement in therapeutic radiography. But just to echo what Gaby said about working with people and having that caring side of you, because at the end of the day with therapeutic radiography you are treating cancer patients, but I find that more often than not patients just want to have a chat, and when we're treating patients we see them over Monday to Friday over a number of weeks, 5, 6, 7 weeks. So we really get to we get that opportunity to really get to know the patients and their families. So having that warm aspect of your approach, and just being really caring. I think that's really vital. And I love talking to people. I love finding out about their lives and who they are. So I think that's really helped me. That part of my personality has really helped me really succeed and enjoy clinical placement. And I think as well, you have to be I think you have to be quite creative and quite curious, because you are dealing with patients, and humans inherently are we're all different, we're all unique, so having that creative sort of mindset and being able to approach situations with and problem solving with like a creative little spin really helps you, has really helped me sort of come to conclusions or come to solutions. So yeah, and also having an interest in tech, like technology, is a great bonus, because we're working with these huge, really expensive, fancy machinery delivering radiation to patients, and there's all these little gadgets that you can that you learn and that you use. So having an interest in technology is a big bonus. And I worked in IT for about 7 years, so I think therapeutic radiography for me gives me a nice balance of that enjoyment of technology and like that patient contact. So yeah, those, I would say all those things have really helped me in therapeutic radiography so far.
Yeah, no, that's great. And as a fellow therapeutic radiographer, I would echo that. And I think we often say it's where technology and compassion meet. It's quite a unique profession in many ways, isn't it? Thank you for that. Yeah. Alisha, tell me a little bit about what sparked your interest, and what sort of bits of your personality do you think have really kind of helped you in your career?
Yeah, so it was really interesting hearing Gaby and Sally, just because there is a lot of similarities I'm seeing between the AHPs there with the personalities. Just to start off, I loved science. It was something I was really interested in. I pulled a bit of a short straw, and I did do all the sciences at A level, so I can definitely relate to Gaby with the biology there. But it definitely got a lot easier at uni afterwards. So I just loved science, and orthoptics includes quite a lot of biology as well as physics, as well as a lot of the people person side of things as well that people have been mentioning. It's so important to enjoy helping people in these kind of careers. You've got to build a lot of rapport with your patients. Just starting off, you need to take a case history from your patient, and they've got to trust you to give out the information that you need to be able to form an accurate diagnosis and determine what management they need. As well as when you've got kids that are struggling with compliance on certain treatment, it's not the same as talking to an adult, where you can clearly explain the rationale for the needing the treatment. They're a kid and they don't understand, and we're trying to make them wear an eye patch or put eye drops in them and they don't understand. And a lot of the treatments we have are dictated a lot by the parents as well, so it's getting the parents on side as well. So being a people person was definitely very important. And I'd probably say a little bit of detective work as well. So that problem solving side of it, we have a lot of tests that we have to do on patients, and you won't get your answer just from one test. You've got to add up each piece of the puzzle, and then things start to form. So I find it really interesting and I love doing that. Some people find that quite frustrating and don't enjoy it, and they just like to know something straight away. So it really just depends what type of person you are. Working with eyes as well, it's a very, very small part of the body. So you've got to be quite meticulous in your measurements and looking for things. Things are very subtle. So it's a keen eye for that detail as well. I'll probably say they're the main parts of my personality that have really helped.
Brilliant. That's lovely. Thank you, Alisha. And Arron, how about you?
Similar to you guys, just really always been interested in science, mainly sort of anatomy and physiology was always sort of a strong point in school, I remember. In terms of my personality, I would say probably more the soft skills I bring to the role, just building rapport with people from different diverse backgrounds and experiences, being quite resilient, being quite adaptable, sort of having a level of emotional intelligence as well, and sort of reading people, or at least tuning into people's different characteristics and natures, but also quite reflective as well. I think a lot of my practice, I tend to reflect on dealing with different people, situations, and that kind of helps me to individualize my interactions with people, or at least my patients I work with. Mental health is quite acute, so you never know. Every day is different. People's moods fluctuate quite differently, so being quite resilient also is quite a skill that and patient, I would say as well, that is kind of I've had to build but also nurture. But I think underlining, I've kind of had that personality there, but it's really challenged me working in mental health. So those are sort of the main personalities, if you like, that I bring to the role.
Thank you, Arron. That's really interesting. And I think what I've kind of gathered from all of you is that actually your personality will probably fit any number of different AHP roles. And I think what's really coming out loud and clear, I guess, is around wanting to help people and that compassion and really wanting to sort of nurture and look after, and those sort of really important kind of communication skills, as well as a sort of a keen interest in science and technology. But depending on what AHP professional route you go down, there are nuances to those professions that will enable you to really kind of tune into some of your kind of really specific personality traits and kind of interests that really kind of make you who you are, really. So I think it's about kind of really saying that any AHP profession might be worth looking at, and you will probably find something that will fit your sort of skills and interests and your kind of personality. So yeah, that's been really interesting. Thank you for that, everybody. And I'm just wondering, moving on from that, what have you really what's really been like the best bits of your learning journey so far? I mean, some of you are perhaps quite some way down your learning journey, and others are still kind of part way through it. But Gaby, what have been the best bits so far, would you say?
Thanks, Mandy. So I'm definitely further down that journey. I qualified as a physiotherapist in 2000, which, yeah, is hard to believe. I know I have such youthful looks. So I guess for me, it's a couple of things. Firstly, it's probably the unexpected. So it's when things haven't gone according to plan. That's either with patients or in terms of job opportunities. It's maybe it's definitely been opportunities that I didn't expect have come along, and have made me sort of either pulled me up short or made me stop and think and challenged me. And I think that's what's fantastic about working as a physio or any AHP profession, is there are so many opportunities and it's really varied. So my current work as a clinical fellow is an opportunity working more strategically with Health Education England, and that's something that I didn't envisage myself going down or seizing, but actually I've learned so much that is transferable to my clinical work, my patient care, and also in terms of leadership and service development and improving patient care, really. And that sits very much at the heart of all that I'm doing. So I guess it's stepping out of my comfort zone, being prepared to see opportunities that I didn't expect. And that's probably my biggest and most rewarding part to my learning journey. It's also the people I've met, and the people that have influenced me, inspired me, and that's patients, that's families of patients, that's my colleagues, that's leaders. Those are probably big highlights for my learning journey. And then equally, it's, as I've mentioned before, getting a kick out of improving people's lives. So it's having somebody who is perhaps recovering from surgery, and the input and the one-to-one with those people and their carers, and then seeing that, few weeks, maybe months later, that their life is really improved and they might be back to where they were before the operation or even better than that. So it's probably those three key bits for me.
Brilliant, lovely, thank you. And Sally, you're obviously partway through your learning journey, but what have you enjoyed most so far?
Yeah, so so far, I think for me, the patients absolutely absolutely just make the entire sort of 3 years so far just so rewarding, and being on clinical placement where I can sort of put my theory and everything that I've learned in uni into clinical practice. So being on placement is that bridge between like putting all of my academic knowledge into practical knowledge. So it's a new and different way of learning. But the patients just speaking with the patients, getting to know them, because 5-6 weeks is a long time, and getting to know their family, as well. I've met some really incredible patients who have taught me how to be a better person, but also how to be more sort of resilient. And just echoing what Gaby said about just meeting people. I've also worked with some incredible radiographers who truly do care about other patients and other people in their clinical practice. So they're doing everything that they can to improve the service that they deliver to patients, and it's just incredible to be working alongside these people, and also learning how how technically advanced cancer treatment has gotten is just so interesting. And all of these just learning about all of these cancer treatments has been really rewarding, so I really love that aspect. Lots of best bits so far, and I'm really looking forward to what the future brings.
Lovely, that's great, thank you. And Alisha, what about your learning journey? Is there anything that's really kind of stood out for you?
Yeah, so I've just obviously finished university, so I've just ended that part of my learning journey. But I think one of the main things about being an AHP is you're always learning. There's never a point where it ends, whether it's starting a new job or there's like more research that's comes out, you're always learning something new, which is really interesting. I would love to reiterate what Sally was saying about clinical placements, just bridging that gap between the theory and the practical. it's such an amazing part about doing an AHP course, and particularly in orthoptics, we can be sent to anywhere in the UK, any hospital in the UK, for about 4 weeks at a time, and you get to see such a broad range of patients, and different hospitals do things a lot differently. So completely different side of learning there is just adapting to a new environment as well. You learn so much from meeting more experienced orthoptists as well, and just getting their advice on how to do things and adapting that into your day-to-day as well, thinking what you think's more suitable. It's making your own decisions as well on what learning you think's beneficial. And I guess, obviously, the best part is seeing that you've helped someone at the end of the day. So when we have a kid that comes back and they've been doing some patching for a while and you see the vision's improved massively in their eye, or you help a patient with a double vision and they come back and they're like, I haven't had double vision in months. They're some of the most rewarding parts of doing the job, I'd definitely say.
Oh, that's lovely. Thank you, Alisha. And Arron, what about you?
My journey, I think, from a patient perspective at the moment, my interaction with patients has just been really rewarding. I think the NHS has given me the experience to work with so many diverse people, coming from different backgrounds. I think at some point, no matter what aspect of the NHS, most people would have come through the NHS at some point in their lives, and either they're going to have a positive or a negative experience. And I feel that if you're somebody that's had that interaction and you're really, committed to helping people, it could be such a life-changing experience for patients on the receiving end. And I think I've had that experience, which has just been really profound for me as a person, and it's helped me to sort of harness some of those qualities and skills that I've had that I didn't even know I had, but have impacted on patients in some way. I feel like I've been quite fortunate as well to work in a really good supportive team. I think that's something that I'm quite passionate about in regards to strategies going forward, especially within the AHP support network, is sort of how to build, a valued team, and a collaborative team that all works together, that support each other, and facilitate to services so that they can be patient focused. So that's kind of really good fundamental experience for me to take away. As development, I was quite surprised in how unique and diverse the different roles are within the NHS and the career progression opportunities as well. Since I started, I've managed to go on like motivational interview courses. Now, I know there's a lot of apprenticeships available. I think the next step for me is to probably actually go into a physio apprenticeship at some point, potentially. And there's so many different other career progression opportunities and support networks and mentors within various trusts across the NHS as well. So it's really promising prospects, I think, for the future. I think events like these also just exposed, the way forward in which we're going in terms of the workforce and progressing people and getting people to work from the NHS with varied skills and experiences as well, and just really sort of diversify our workforce as much as possible. So good prospects for the future.
Yeah, no, that's great. Thank you, Arron. And that leads me really on to my last question, actually. And it would be kind of, what advice would you perhaps give to someone thinking of pursuing an allied health profession's career? Perhaps someone that perhaps thinks they don't have maybe much experience, perhaps hasn't kind of thought of this before. What sort of advice would you give them? Gaby?
Do you want me to go first? Oh, there's a bit of feedback. I would obviously say go for it. I've had a fantastic career. I think, do some research. Have a bit of a read. Go to websites, which I think we'll probably post in the comments. Have a look on NHS careers. There's AHP stuff in there. If you can, I would really recommend doing some work experience or some shadowing, even if it's a friend of a friend or a family member, because you do want to be informed. You want to know what the job actually looks like and whether that's going to fit you or not. So I definitely recommend that. As you've seen from today, there's lots of different professions under the umbrella of allied health professions, and some of them, we do have common themes in terms of personalities and what the job involves, but then there are nuances, there are real differences that will suit some people and not suit others. So do a bit of research, a bit of shadowing or work experience if you can, And also, if there are barriers, which Arron was just talking about, if there are barriers, there are loads of different routes in. That doesn't mean the job's not right for you. So seek advice. There's loads of people that I'm sure that you can go to. So seek advice, speak to somebody, have a look around. Apprenticeships are out there. There's T-levels. There's lots of different routes in. So if there are barriers, I would really recommend don't put that off. Don't make that think that. Don't let that let you think that this is the wrong profession for you, because it might be, but it might not be. So push those doors, and yeah, I'd strongly recommend it.
Oh, lovely. Thank you, Gaby. Sally, any top tips?
Gaby's taken the words straight out my mouth. But yeah, don't be afraid. Don't just go for it. You don't know. Knock on those doors. You don't know what's going to be behind them, and don't think it's too late for career change as well. That was a big obstacle of mine. And just go for it. Get out there, do the work experience if you can, and just speak. Just speak to people already in the profession. They'll give you a personal insight. And as Gaby said, it might work out for you, it might not, but you never know. You miss 100% of the opportunities that you don't go for, sort of thing. Yeah.
That's brilliant, lovely. Thank you. Alisha, have you got anything else that you can think of?
Yeah, I 100% agree with everything Gaby and Sally have said so far. I think what's become quite apparent is there is a lot of overlap between the AHPs. So having a proper research and seeing what's for you. There's loads of good websites out there. Like I See the Difference does a lot of information about different AHP careers, just getting a bit of an idea of what you're interested in. If you can shadow someone, that's great. I know local hospitals get quite busy, but if you try and get in contact with someone, they'll usually want to try and help you out. So it's just trying them things. But even if you can't get explicitly the experience in a hospital, different experiences can be very beneficial. So I had work experience in a nursery. If you, for instance, have work experience in a care home or something like that, because we work with a lot of kids and elderly in orthoptics, but just very similar things like that, just things that might link in, not directly, but indirectly, you still have them same skills that you're showing and things that you're interested in. Definitely have a little look on university websites as well. A lot of unis now have like a chat to students area. And I know Sheffield did have an orthoptics one at one point, but I'm pretty sure they might have replaced them. But I know most unis have them for different courses as well. So definitely ask them questions to people that have the first-hand experience. And places like the student room, I worked on there when I was a student. So there's loads of threads on there about orthoptics that I've helped out on. And I've seen loads for different AHPs as well, where people just chat and share their own experiences. So definitely check them out and just double check everything's for you, really. But I'd say go for it anyway, because you won't regret it. You won't regret it.
Oh, that's lovely. Thank you, Alisha. And Arron, is there anything else that you can think of to add at all? One kind of top tip.
Yeah, for me, just to be open-minded. And I say that because although AHP roles are under quite an extensive umbrella, I think it's the NHS in itself is quite diverse, and there's so many different avenues to develop your career and maybe skills that you might have that you can bring to the table. For example, just like research projects, for example, QI projects, things like sustainability, things that do come away from the clinical practice and focus more on leadership and more sort of ethical approaches to work. And I think within the NHS, there's always something to bring to the table to make the NHS more diverse, more skilled. And I think if you're open-minded and you're able to sort of expand on those ideas, the career opportunities are sort of limitless almost. So I think being open-minded would be my top tip.
That's brilliant. Thank you. And I think that's a really good point to round up our conversation this morning. And I think it's been really inspirational listening to all of you and your enthusiasm and your love for your individual professions, and also to really kind of see how your experiences and interests and personalities really kind of shine through and make you who you are in terms of your AHP professional background. And it's been fantastic to have you this morning. I hope that's really given you some food for thought in our audience, for really kind of thinking about whether an allied health professional career might be for you. There are lots and lots of information and resources out there. Please do pop along to the virtual booth. There will be lots of information there for you. And then you'll also be able to find links to lots of the resources that we've mentioned this morning. And also thinking about some of those AHP careers that might be for you. So thank you ever so much this morning to our panel. It's been lovely to see you, and enjoy the rest of your time on Health Careers Live. Thank you, everybody. Bye-bye.